Kevin and Judy, thank y'all for the opportunity, and thank this crowd for being here today. It's a Friday afternoon. There's a lot of things you could be doing, but you're taking your time to be here today. And all your listeners, too, you guys do a fantastic job of getting this message out. You know, it's amazing. I guess I've been a congressman now for 7 years and about 3 months. And this past weekend, I saw something that I never thought I'd see in my political career. And walking back and forth to the chamber, I always walked outside, and seeing the tens of thousands of people that were in Washington, I saw one sign time and time again. It was a little placard, I guess maybe like a 1 foot by 1 foot. And it had 3 little words on it. And it said, "You're not listening." And it's amazing what has happened with this Democrat leadership that has rammed this bill through backroom deals, through shady shenanigans, I think, for a government takeover of health care. I mean, in a nutshell, Kevin, Judy, listening audience, $600 billion worth of tax increases, $500 billion worth of Medicare decreases, $52 billion of tax increases for businesses, 12 new different categories for men and women, working men and women, that will be tax increases again. And don't take my word for it. Caterpillar, one of the largest employers in the nation, and certainly one of the largest employers in South Carolina, sent a letter to Speaker Pelosi, sent a letter to John Boehner, minority leader, and said this alone would cost them $100 million in additional health care costs. And at a time, and Joe was just exactly right, and I want to kind of piggyback on that, in a time when we're looking at what we can do to create jobs and create wealth in America through the private sector, here we come with the federal government that's going to control 1/6 of the budget, and it's going to tell men and women across this nation who they can be, what kind of doctors they can have. And there's always been a debate here, Kevin and Judy, about rationing. The proponents of the bill say, well, there will be no rationing. Well, let me just tell you the facts. With 30 additional million people afforded government health care and no doctors increasing, in fact, when you talk to doctors and you talk to doctors' organizations, we may lose 1/3 of our doctors. I don't know how you can help but say there will be rationing or a cutting back of services or a degradation of services, whatever you want to have. But it is concerning. And out of all the facts and figures that I quoted, and I know we'll talk some more about some of this stuff, but the most concerning thing I saw, ladies and gentlemen, was the fact that people in America were standing there and screaming at the top of their lungs, and they just feel like nobody's listening.